I think the workflow is pretty natural. It's an overlay, so it's basically putting the cursor and then tapping the microphone wherever the screen would be for the end user, for the clinician in this case. So I'd say the learning curve is null to minimum. They're used to this sort of microphone tap experience. Um, but more importantly, the sell's pretty easy when you can start to show data, um, like you're showing on the screen, both reduction in absolute time um, for total dock time, but also seeing improvements in that last note about completing documentation in the home. And this is really at the heart of home care. Patients, want more attention, and often with EMRs, they feel like they're not getting it because we're looking at a screen and not looking at them. So being able to speak and actually capture that documentation without our hands and putting our hands where they belong um, is a win-win. So not only are we getting more of it done in the home, and from a quality lens, that's a good thing. But also for all the reasons of efficiency, it's an overall satisfier when folks begin to take that leap of faith and adopt, and then get more proficient over time. Absolutely. I think efficiency just lends itself to many things. Better work-life balance, better employee retention, satisfaction, work-life balance. Obviously, faster dock times. There is financial teeth around that. Think authorization, think billing, think accuracy, think NOAs or notice of admissions for those that are in the Medicare space or Medicare Advantage space, as you've mentioned. These are all things that have real repercussion. So speeding things up in a high quality sense only contributes to our, I would say, financial viability as an organization in this ever constraining regulatory environment. And as things don't ever decrease, as we know, they generally add on. This is a essential ingredient to both our sustainability now, but also addressing workforce for the future. They're going to expect it, and we need to be able to provide it to be relevant in the future. It's here to stay for us. There's no turning back. Um, and I think with more, behind us, if you will, as you mentioned, we started back in roughly June. We're just seeing our data trend in the right direction. So I think that just bodes well for that sort of, keep practicing, keep using it. We've actually made it mandatory now for our staff just to say, you've got to use it. And I think it's a selling point when we have the data of their colleagues and coworkers that will demonstrate discipline agnostic and even document agnostic, meaning start a care or revisit, doesn't matter. They're all trending in the right way, which this slide more or less aggregates. But it's here to stay, and I look forward to more. Like you mentioned, ambient listening. Like we're just excited about what technology could do to mitigate all of the headwind that we've experienced. All of us, all organizations, everything in healthcare has experienced in these last certainly 5 years of clinician burnout and trying to be viable for the future. We've got to have it, and this is the one thing that's actually bringing some relief is technology. So we intend to full steam ahead.